So as we continue to get improved outcomes with continuous flow pumps, we certainly have the most experience with the HeartMate 2 device. The continuous flow pumps present us now with some unique issues and problems that we'll have to sort of learn as we go. And one of these is how you measure blood pressure. So with continuous flow pumps, they provide the same amount of blood flow as a sort of normal heart in a young person would, which is very positive and good. The downside is because you now lose the pulse. It makes it very difficult to measure the blood pressure by standard methods. Because of this, there are certain patients, and maybe the majority of them, that have significant high blood pressure or hypertension, which goes unrecognized. So in these very sick patients, we continue to have improved outcomes, and many patients, if not the majority, are living 2 years and beyond that, happy, healthy, at home, and very active. So as we have many patients now surviving long-term, we also are starting to see issues that are related to long-term support. And one of these would be stroke. Now, in these patient populations that we're treating, and a significant number of them are patients that are not transplant eligible, meaning that they're in their late 60s, sometimes 70s. Certainly stroke is a potential problem. So even in this patient population, without the pump, they always have some ongoing risk of stroke. And depending upon their age and underlying medical conditions, it probably is somewhere around 3 to 6% on an annualized basis. To date, we're seeing a stroke rate of somewhere around 8 to 10% overall in this patient population. So it is increased, but it's not quite as bad as we had anticipated when we first started the study. But having said that, we would like to ultimately get it at or below the average for this patient population. So one of the issues will be is how to measure blood pressure and how to manage it and the pills that we use. Because the difference is now the patients don't have a systolic blood pressure, they have a mean arterial pressure. So when we use blood pressure medicines, the issue becomes is what even is our target? And the other is, as time goes on, we learn more and more as to their effects on the blood elements and possible blood trauma. Originally, with all heart assist devices, we were always worried with thromboembolic events or blood clots and clotting. And it turns out that with the newer devices, this is actually a relatively rare event. It can happen, but it's actually relatively uncommon. But a more common issue is actually bleeding, which was unanticipated. So we're starting to learn more and more about what happens when you have these sort of high-speed propellers that the blood goes through and the effects that it has on not only the blood, the red blood cell, but the blood elements and how it might alter coagulation. So most likely these strokes that we're seeing certainly are potentially related to hypertension, but also contributed to the fact then that they may actually be a small stroke and sometimes maybe even just a run-of-the-mill stroke that you might see in an elderly individual that then becomes complicated by the fact that their blood doesn't clot normally, and what might have been a relatively minor stroke ends up being a large stroke then because of bleeding secondary to the device and the new blood flow patterns that we see. So the patient outcomes have continued to improve. The complications are certainly less than we had always anticipated and are certainly reasonable, but we'd like to see continued improvement. And part of that continued improvement will be learning how to measure things such as blood pressure, how the blood affects, or the pumps affect the blood, clotting, and what is therapy that is needed for the pump versus blood thinners that might be needed for the patient.